diabetes, lifestyle factors, heart valve disease, severe lung disease, primary disease of the heart muscle called cardiomyopathy, congenital heart defects, and then infections as well. I'm not going to really touch too far on any of those here for you. But this is just to kind of give you guys an idea of what, there's two different types of heart failure, and I'm going to kind of have you guys help me walk through them here. So here's our beautiful normal heart. Nice, perfect muscle tissue around both of the ventricles there. So systolic, do you guys remember that term systole, what it refers to, what cycle of the? It's the working phase, exactly, it's the contraction. So this is a heart failure, this is a problem with the squeeze of the heart. In here it's kind of showing these very thin walls, and do you see how this whole area is just dilated out? I like to think of the heart as a slingshot. So a beautiful heart, you're pulling back, you let go, and out it goes. Let's think though if we've got a slingshot and it's been used 20 million times and it's just floppy now. You try to pull back on it, but how far is that rock really going to go? Not too far at all. So that's what's happening in this one where the squeeze isn't going so well. So on the opposite, the diastole, what phase of the heart is that? The resting phase, exactly. So do you guys kind of see on this one, this muscle here is extremely thickened and it's stiff. So the amount of blood that can get in this section here is not great. And so that's essentially that type of heart failure, is that you've got this thickened vessel, this thickened wall. The squeeze on it might be okay, but there's just not enough blood getting into that ventricle the way that it should be. So, but big picture on all of these with heart failure, the problem is the ventricle is not working the way that it needs to be able to squeeze the blood out to the rest of the body. Okay, so there's, sorry. I'm going to turn that off. Okay, so there are two types of heart failure. Sometimes you can just have one type, sometimes you can have the other type, and sometimes you can have both. And it actually has to do with the sides of the heart. So we're going to talk first about left-sided heart failure. So I'm going to have you guys kind of walk me through this. Here's our left ventricle. Where is it pumping blood out through? The aorta to the rest of the body, that's right. So where is this blood coming from that goes into the left atrium and the left ventricle? The lungs, perfect. So what happens if this is not squeezing properly and the blood starts backing up? Exactly, so your lungs now are getting filled with fluids because it's backing up into there. So what symptoms would you expect to notice? Yes. Yes. Shortness of breath. It can worsen with activity, it can worsen when laying down. Fatigue, cough, confusion. Confusion, I mean, one of the first places that the blood is going to be pumped out to is up to your brain. If it's not getting the right amount of oxygen, you might notice some confusion. Increased heart rate. So that's your body's way of going, we're not getting enough oxygen. Let's try to squeeze faster and see if we can get some more. So you might see increased heart rate with this as well. Okay, now we're going to talk about our right-sided. So where does the right ventricle pump the blood out to? That's where it comes from, yes. So that's where it's coming from. It goes out to the lungs, perfect, and it's coming in from the veins, like you were saying. So let's say this right ventricle is not working the way that it's supposed to. Where is that blood going to end up backing up to? What'd you say? The veins, yes. Right, and the rest of the body where all the veins are pumping out to. So in this, you can see fluid buildup in other areas of the body. So you can see fluid buildup in the abdomen, which is called ascites. You can see swelling in the feet and legs. Have you guys seen edema on patients before? Especially where you can push in. I always thought that was oddly fascinating. Right. It doesn't just pop right back out. Yeah, you can actually make indents in their skin. So yeah. Fatigue. Going to be with all of these. And then weight gain, because now you've got fluids that are supposed to be moving around that are just building up in other parts of the body. So those are some of those. And I forgot actually, on left-sided heart failure, cyanosis, that's a term meaning bluish discoloring of areas of the body, generally like your ears or your nose or your fingers or your toes, where there's just not enough oxygen getting to those areas. Okay, so this again just is kind of an overview of those symptoms. Lots of fatigue, rapid or irregular heartbeat, fast weight gain, swelling in the ankles, feet, legs, abdomen, neck, weakness, shortness of breath. Over on there, you can see some pitting edema on that gentleman's foot, or lady's foot, I'm not sure. The gentleman on the far left, he's got ascites, big swollen abdomen there. And it might be kind of hard to see here, but there's some cyanosis to this person's fingertips, that bluish kind of purplish discoloration there. Okay. Sorry guys, I've got to get out and we'll have to get back in here again too in a second.
When you have heart failure, the amount of blood being pumped through your heart and around your body is reduced. This reduced blood flow makes your kidneys behave as if there is not enough blood circulating, as though you have experienced significant blood loss. Therefore, your kidneys reduce urine production and retain more fluid. This extra fluid increases the volume of blood in circulation. However, your weakened heart then struggles to keep pumping this additional fluid around your body. The blood backs up in the blood vessels, causing fluid to leak out into other parts of your body, where it accumulates. This fluid accumulation is known as congestion and causes the main symptoms of heart failure. This accumulated fluid reduces the lungs' ability to take up oxygen, and so causes breathlessness and tiredness. Blood naturally pools in the ankles, so fluid also accumulates here, causing swelling in the ankles and legs. Fluid accumulation in your liver and digestive organs reduces your appetite. Finally, all this additional fluid in your body can increase your weight.
Does that visual kind of help explain it a little bit more as well? Okay, sorry. Okay, there we go. So the biggest thing I wanted to talk about from that, so the heart failure in the kidneys, the biggest thing, the kidneys are not getting what they need. They're thinking the blood amount is not enough, so they're going to do what they think they need to do, which is hold on to salt and water, so sodium and water. But the problem is now there's extra fluid. Well, what do you think that a ventricle that's not doing a great job on its own, you add a bunch of extra fluid to it, it's going to do even worse. So the cycle continues because now the kidneys are feeling even more concerned, and et cetera, et cetera. The cycle continues. So what kind of stuff do you think might be ordered for this patient? This is kind of a nursing question, but I'm just going to, fluid restrictions. There you go. Because yeah, you don't want this patient to have a ton of extra fluid roaming around. And again, what goes with fluid? What's the thing I just mentioned? Oh, no? Okay, I might not have asked that very well, but so sodium. Sodium's another one. So these patients are going to be on salt restrictions, sodium restrictions, on a low sodium diet. What do you think that picture there is kind of helping explain? Yes. So these patients most likely are going to be on strict intake and outputs, so that you are really need to be on top of every time they go to the bathroom, you're checking it. Every time they're drinking fluids, you're checking it and recording it properly. What about that thing where they talked about if you're constantly having extra fluids on you, what number might change? Weight, yes. So a lot of times these patients are going to be on daily weights as well, and that's one thing that you guys will most likely be helping out with. And of course, the best practice is to always get a standing weight versus a bed weight, if at all possible, because things can shift on the bed and you might not have exactly the amount of blankets that you started with, et cetera, et cetera. So if the patient is mobile and you want to get a standing weight. That's going to be the most accurate. Okay. Know that a lot of these patients, they're going to be on some sort of a medication that's going to help get rid of this fluid. I don't know if you guys have heard of Lasix or water pills. Yes, you know it. So just be aware, they're likely going to have to use the restroom a lot. So keep that on your radar. You might be seeing some call-lights. And then these patients, everything's going to kind of make them tired. So try to do what you can to help not push them too far. Clump their cares together, do certain things at the same time so that you're not wearing them out too much. So symptoms to report, of course, anytime you're having a patient with chest pain, you want to let somebody know. If they're having increased fatigue with or without exertion, increased shortness of breath even while lying down. And again, some of these patients, this kind of is their baseline. It never hurts though just to go let your nurse know. Say, I don't know really what this guy's normal is. He just seems real tired doing anything. Do you want to come check him out? And then you'll kind of learn maybe what this patient's normal is, and then you might not have to go let the nurse know every time, but always good to know. Blue coloring, especially on the ears and the nose. Weight gain, this is something that you'll be putting in the system, and so the nurse should be just monitoring that as well, and the doctors. Rapid heart rate, so if this patient's not on telemetry and you go in and you see a heart rate that's greater than 100, and especially if they're feeling any symptoms at all, you'll want to let your nurse know. New confusion or memory lapses, irregular pulse, or dizziness. You always want to be in touch with your nurse about things that are going on with the patients. Okay, questions on heart failure. All right, we're moving forward. So deep vein thrombosis. This is a blood clot that forms inside a vein. Usually develops when blood pools in a vein for an extended period of time. So the way that the blood gets back up to the heart from the lower extremities is that the muscles of the legs actually do the work to help squeeze that blood back up. So somebody who's not walking around very much, somebody who's just laying in bed, they don't have that mechanism to be able to push the blood back up to the heart, and so now the blood's just pooling, and anywhere the blood pools, a risk for a clot to develop happens. If the clot breaks away from the vein, so that's what you're seeing in that far right slide over there, is an embolus. And that's where it breaks off and it moves, and that's scary, and we'll go into that in just a second here. DVT, so deep vein thrombosis, usually occur in the lower legs or the pelvis, but you can see them, patients who have PICC lines, like a more permanent IV line, clots can develop on those. I mean, truly, they can develop in any of the deep veins. Warning signs. So if you've got a clot in one of your veins and the blood's not getting back up to the heart, you're going to notice swelling because fluid's going to be pooling. Changes in skin color, so you might notice more of a bluish, purplish kind of color. Warmth in the area of swelling, and a lot of times that's an inflammation type process, an infectious type process that's happening. The body's responding to this not right. And lots of pain. They're going to have leg pain too, generally. This is in the perfect world if every DVT presented the way that would make us all know exactly what it is. But those are generally the symptoms that you would notice. So here's a couple. These are really obvious ones, but just to kind of give you an idea, you can kind of see this one's a little bit more purple. If you can see the foot there, it's swollen. Same with this, and the one on the left over there is going to be one that has a DVT too. But you can kind of see the idea of what a typical DVT would look like. Risk factors. So if you're over 60 years, if you're obese, smoking, birth control pills, bed rest, cancer, pregnancy, recent surgery, and a genetic predisposition to clotting. So let's talk about over 60 years old, obese, smoking, bed rest, cancer, recent surgery. How many of those are going to be your patients out on the floors? A lot, right? Okay, so every patient that comes in, on one way or another, the doctor's going to be addressing this. And so we'll talk through the things that are often going to be ordered for these types of patients and how you guys can be assisting with this. So what do you guys think for prevention? The picture here kind of helps give you a little bit of a clue. TED hose, perfect. Elevation, okay, yep. Exercise, early ambulation for the patients who can, post-surgery, getting them moving around. And I don't know how much you guys have worked in the hospital setting, but do you know those little things that squeeze, little machine that squeeze on the patient's calves?
I forget what they're called, but we have
Do you? Okay, perfect. Well, I'll tell you what they're called. They're called sequential compression devices. We call them SCUDs. So common for the majority of patients around here, but it's super important. As you can imagine, if a patient is in bed rest and cannot move, well, what's going to get the blood back up to their heart? What's going to prevent these clots from forming? They're these fun little things that wrap around somebody's leg, and it's a machine that actually will squeeze one side and then it'll squeeze the other side. So it's going to do the work to get the blood back up. So, and that's something that you guys, you're going to be taking those scuds off when you're getting the patient up to the bathroom. When they come back from the bathroom, make sure they get back on. Okay, so this is the one that we want to talk about. So the DVT itself, there's definitely some complications that happen with it, but the biggest one that we get scared of is if an embolism happens. So let's say our blood clot's right here, and a part of it or all of it breaks off and it moves. Well, it's going to make it through these bigger vessels here, but by the time it gets into, it's going to end up in one of the smaller vessels of the lungs and what's called a pulmonary embolism, which is a medical emergency. So symptoms of that are going to be kind of what you guys would assume, but what kind of symptoms do you think would happen with a pulmonary embolism? Chest pain, yes. Absolutely. And a bloody cough. So in the chest pain too, it can worsen with deep breaths. And so this, a lot of these have similar symptoms. So that's where it gets a little bit hard. But again, no, just generalized, any chest pain, any shortness of breath that's new, a bloody cough, anything like that, you're going to be wanting to let your nurse know that this is going on. Fast heart rate can come with it, and then also blue lips or nails. Okay, so tell the nurse immediately, things we already talked about. Anytime shortness of breath, anytime chest pain, fast heart rate as well. Report to the nurse. So you want to let them know. You don't need to urgently run out of the room, but let them know if you're noticing one of the extremities is larger than the other. And when you were helping the patient out earlier in the day, it didn't seem to be that way. Any swelling, pain, or redness in the ankle, calf, or thigh, pain in the legs when ambulating or when walking around, and then a cough, especially if it brings up blood. Okay, so if someone has a DVT, that's actually why they're here in the hospital. They found out that they have one. What kind of things can you do? I know one of you guys had mentioned earlier about elevating an extremity. So that's one thing that you can do to help promote blood flow coming back. And then activities, and it's as directed by the nurse. And again, this is one you'll just want to have a chat with your nurse about though too. Depending on where the clot is and how severe it is, the doctor might have different orders for it. So you'll just kind of have to figure out what the game plan is going to be for them. So imagine you have a patient who does have a clot in their leg. What is one thing you can think of that you might not want to do? Because if you do this, it might dislodge the clot. Yes, perfect. So you do not want to massage that leg. You do not want to perform range of motion on a leg. You don't want to do anything where there could put that clot at risk from moving around at all. Okay, that was DVTs and PEs. Questions on that at all? Okay. All right, so we're on dysrhythmias. This is a very generalized term for anything that's going on with the heart, like the conduction, the beat is not going quite the way that it's supposed to. I don't know, I just thought this was kind of a cool visual, but that's a heart cut in half, and that's kind of a perfect view of what it should be looking like. So it's something that's not doing that. That's a dysrhythmia. May have a normal, abnormal heart rate. It might be irregular. You can have random, irregular beats. You can have a predictable pattern of irregular beats. So lots of things going on that could be. Okay, what's a normal heart rate, guys? Oh, heart rate. She's got it, yeah. 60 to 100 is going to be your normal. Do you guys know the term bradycardia? Slow, perfect. So that would be anything under how many beats per minute? Perfect. Anything less than 60 is bradycardia, slow heart rate. So sorry, I'm in your way there. Tachycardia, fast. Okay, so those are your heart rates that are going to be greater than 100. I would say as a generalized rule, if you're going in, and especially if a patient's not on telemetry, so the nurse doesn't have eyes on what that heart's doing, if you have a heart rate less than 60 or a heart rate over 100, it would not hurt to go let your nurse know. Sometimes patients live in the 50s, sometimes, especially if they're having pain or they're sick and just not doing well, a heart rate might be elevated and that's normal, but it always doesn't hurt to have that communication. just brief overview of a couple of dysrhythmias you might notice on the floors. Atrial flutter. So we've got our squeeze, right? Atrium, ventricle.